Hi guys, it's Renee again. This voiceover is going to go over the adolescent stage of development, and this is the final stage in the pediatric wellness portion of this course. So we will start with growth and development. Then we're going to move over to assessment findings specific to the adolescent client. Then we will discuss alterations to nursing interventions. Again, this is going to be based on the developmental age. We will then discuss health promotion and education for the adolescent, and then we'll discuss the immunizations for this age group. So now we're going to move on to cognitive development. Cognition moves from concrete to abstract or analytical thinking in this adolescent developmental stage. The formal operations or abstract thinking is the last stage of the cognitive development, according to Piaget. You can click on the hyperlink in this slide for a more in-depth look at Piaget's theory for this developmental stage. The prefrontal cortex, this is still being developed at the adolescent stage, so critical thinking hasn't quite yet been fully achieved during adolescence. Early abstract thinking in the adolescent is when there is inductive and deductive reasoning, or the ability to connect separate events, and the ability to later understand consequences. Abstract thinking in late adolescence will be displayed when they're able to understand complex concepts, and they do this by using an analytical method. And they view social situations from a societal perspective, so a larger picture is really what they start to have. The analytical method is a generic process where they combine the power of scientific method or research with the use of the formal process to solve any type of problem. That's why I have the picture here on the slide, because they start to understand things at such a deeper level during the late adolescent period. Moral and spiritual development for adolescents. So according to Kohlberg, adolescents and young adults develop a respect for law and order and a society-maintaining orientation. Adolescents are going to start to question values of family and society before they start integrating their experiences and beliefs into a personal moral framework. Evidence suggests that spirituality has a positive effect on health-related quality of life in adolescence. Spirituality may also be protective against engaging in risky behaviors. It's really important for nurses to assess the spiritual beliefs and values when working with adolescents and try to incorporate these values into the nursing interventions that you're going to use with them. So motor development rapidly increases in the adolescent. Just like when they're in the school age years, the adolescent likes to be a part of a team and to be active with their peers for these activities. So activities like aerobics, cheerleading, other team sports, or dancing, they're very attractive for this age group. It is important to know that the school athletes will require yearly physicals along with concussion screenings, which is usually for the male, especially in football, or maybe even females too. If you look at the picture on the slide, that's actually my daughter who plays football. So she's had these screenings as well. The school nurse is usually the person in charge of this and documenting and making sure that these are happening. In this stage, large muscle mass is going to increase in the adolescent, and there's going to be improved coordination of the muscles, and this is both the gross muscle groups and the fine muscle groups. So the cardiopulmonary pump is still maturing in the adolescents, and through this stage of adolescence, like through the young adult adolescent, they're going to be able to run faster and longer, and as they become older into the older adolescent stage, and even more so as they become a young adult. The general assessment for an adolescent, you'll notice again that everything is trending towards that of adulthood. It's a period where they switch from a child to an adult, and you're going to see this in many areas, but just an example is the vital signs. The height and weight is charted in a CDC graph, and it accounts for the typical growth spurts that should be happening. The fluid requirements for this age group are 1,500 mLs, and then you will add 20 mLs per kilo above 20 kilos. And this is going to be per day. The urine output will range from 0.5 ml to 1 ml per kilo per hour. The pain assessment is now a numeric scale, just like you use with the adults, a 0 to 10 scale. The physical assessment flow is typically head to toe. With the exception of the genitals, you're going to want to do that part of the assessment last. You want to make sure you maintain privacy, especially for the adolescents, because remember that developmentally, they're still figuring out who they are, and they are going through many changes with their sex organs, which we'll talk about shortly. And they are figuring out that they are their own individual. And typically the assessment is going to be done away from the parent or guardian. During the assessment findings, if there are any deformities or abnormalities that are noted, you want to be very cautious and gentle how you discuss these with the adolescent because they are still very self-conscious about their body. Along those same lines, you want to be sensitive to weight and measurements. Those who have a history of eating disorders or just extreme self-consciousness about their weight, sometimes it's a good idea to just weigh the adolescent with their back facing the scale so they don't know exactly how much they weigh. This could be very helpful if their weight is an extreme concern of theirs. Variations of the adolescent assessment are included and highlighted in this slide. So with the head to toe assessment, you'll see that with the hair of many of the female adolescent clients, it's commonly found to be brittle, and this is due to the excessive drying of the hair or from dyeing it using hot treatments, either flat irons or curling irons. Sometimes with the eyes, you may notice that they're infected because of excessive eye makeup or makeup that just wasn't removed at the end of the day. Ears should be assessed for any trauma or piercings or gauges, making sure that they haven't become infected. The mouth should be inspected for any ulcers that are related to either smoking or vaping. Wisdom teeth are also commonly coming in at this time, and they may actually be removed. Sometimes they're removed before they erupt, and this is to prevent any further malocclusion or teeth crowding. This could also be a time where there is common orthodontic work going on. Onto the skin, it's going to become more oily and produce more sweat, and this is because of the hormone change that are going on in the body. Acne is very likely because of the increase in oil production, and sunscreen should really be stressed, especially with this age group. You know, they like to have sun, they like to be tan, typically speaking, and of course we want to prevent any skin cancer. Cardiovascular changes are happening, the heart is growing, and at the end of adolescence, the heart's going to be that of an adult-sized heart. Usually any innocent murmurs that were there have either closed up by now or are almost fully closed. The respiratory system, the lungs are going to continue to grow as well. So they increase in length and diameter. They now have a larger capacity for sports to have great aeration and gas exchange. Asthma is still a big concern for this age group as it's the most prevalent chronic disease in children. Moving on to GI, you're going to assess for nutrition and screen for eating disorders. Again, they're extremely self-conscious in this age group, and eating disorders are the most common with adolescents. Neurovascular, this is a rapid development going on here, and impaired judgment as well. With musculoskeletal, the muscles are going to continue to grow during puberty, and especially with the males, they continue to gain muscle mass. The growth plates in the bones are closed and fused typically by the age 20. There are many changes going on with adolescents, especially with psychosexual development, hormonal changes, and sexual maturation. So we're going to go over all of that in this slide here. First, I want you to be aware that the Tanner staging tool is commonly used in healthcare setting, and it's something that you're going to see a lot in the healthcare setting. It's used to determine where the adolescent currently is in the sexual maturation, and it also can predict the future changes that are expected to come. So we're going to split this up into male and female. For females, the development of secondary sex characteristics in the female adolescent, they happen because of the hypothalamus, and it signals the pituitary gland to release gonadotropins. There's also going to be the beginning of breast development, which is typically the first sign of puberty, and begins around age 9 with the bud stage. There's going to be fatty tissue that begins to develop, more in the thighs and hips and breasts, along with the hips broadening. The onset of menses, they usually occur between 8 and 16 years, and initially they will be very irregular. We will also see pubic hair start to increase over the next several years after menses begin. Then the female will grow up to 3 inches a year. during this age group, and they're going to stop growing around the age of 16. There's going to be sweat glands and sebaceous glands that become more active, and this will cause body odor and acne to increase. So now we're going to move on to the male. In the male, the hypothalamus signals the pituitary gonadotropins to release LS and FSH. You're going to see testicular enlargement, and that's going to be the first sign that puberty is starting in a male. They're going to start to have muscle mass increases. Their chest is going to broaden, and facial hair and body hair will proliferate. As the laryngeal cartilage grows, this will also cause the voice to deepen. Pubic hair is going to continue to grow till about age 20, and males are going to grow about 3.5 inches each year, and this too will stop around age 20. It's the same thing in males with the sweat and sebaceous glands. They're going to be more active, and again, it's going to cause more odor and more acne. With the male, you will also have nocturnal emission start at this stage, and masturbation and ejaculation as well. Okay, so on to school screenings. So the hearing and sight is going to be screened for the adolescent. With this age group, they will also typically add in a scoliosis screening. And the school screens for scoliosis either in the physical through the school or by the school nurse. And it's recommended that girls be screened twice at the age of 10 and 12. And then boys are going to be screened once at either 13 or 14 years of age. The screening includes the forward bending test, also known as the Adams forward bend test. And there's a picture of this included in your slide. Okay, so there really are some unique elements to providing care to adolescents. The first one is to make sure that you are approachable. And this one is kind of difficult for some people. You don't want to be their friend and overstep that boundary, but at the same time, you also want to make sure that you make them feel like you're open to what they have to say and that they are at a part, that they're becoming a part of their own healthcare team. They are becoming autonomous, so you want to allow them to do that as well as, in their healthcare. You want, again, to encourage confidence in them and that they can make decisions, but you also want to be supportive of the family and their authority. While there's still confidentiality, they are usually still living within their parents', home. They still have to follow their parents' rules. So sometimes it's really more of finding a balance. You want to support them, meaning the adolescents. You want to be an advocate for the adolescent while still trying to make it work within the family. You also want to encourage the family to work together. So sometimes this is more of the social work side of nursing where you're going to be more supportive. Well, you're going to be supportive to both sides of it because ultimately they have to be a healthy functioning unit outside of the healthcare setting. So you really want to encourage them to work together. So now we're going to discuss health promotion for adolescents. During this age period, they are primarily healthy individuals, and you'll usually see them in the office for health screenings like physicals, for sports sometimes, or if they have acute minor illnesses. But during this time, you also want to make sure that you maintain open communication with them, and you want to ask them direct questions to obtain more information. A key point, too, is to maintain confidentiality during these times. They're very concerned about maintaining confidentiality, and unless it is physical harm or direct risk of well-being or life, you do need to maintain confidentiality, especially with sexual development and sexual health. The next part is age-related nutritional challenges. So because this is such a rapid growth for physical growth, they're going to have an increase in nutritional needs. And we're going to be talking about increased calories, iron, proteins, things like this. You have to make sure that their food choices are healthy and trying to minimize fast food and junk food. On the other side of this, you also have to understand that this is a common time for body image disturbances. So you want to make sure that you're screening for any eating disorders as well. So doing BMI and asking them what they ate in the last 24 hours may be helpful. Safety in adolescence is based on what's going on with them both cognitively and emotionally. So we're going to start off with injuries. Injuries are going to claim more lives during adolescence than any other causes combined. And these injuries can be from safety, like motor vehicle accidents, or a primary cause of mortality and morbidity in this age group. So car safety is essential at this age. Smoking, drugs, and alcohol abuse are common high-risk behaviors for adolescents. So when you combine that with their ability to now drive, it is very dangerous. It's basically the same thing with water safety. If you add mind-altering substances like alcohol or drugs, combining with, water, it's a recipe for disaster. Moving on to suicide. So this is the third leading cause of death in adolescents. The nurse should be aware of signs or symptoms of suicide in adolescents. It may include frequent discussions of death, discussions of hopelessness, dramatic mood changes, and especially loss of interest in friends or activities. These are some cues that you should really look for, and you should be screening for suicide. Violence towards others and firearms. So it's important to note that during adolescence, this is a time period where they have extreme highs and lows. So you want to make sure that any firearms are locked twice and that they don't know how to get into them. If there are firearms in the home, the key shouldn't obviously be with the adolescent. The key should be with the parents, and they shouldn't have access to them. So there are some specific issues that are related to the adolescent, and they're also related to risk-taking. Risk-taking behavior is considered to be a normal part of growth and development during adolescence. They include things such as tanning, body piercings, tattooing, the use of e-cigarettes. These are all behaviors associated with identity formation. You do want to remind the adolescent during this time period to remain as safe as possible and take the necessary steps to prevent unwanted consequences such as teen pregnancy or sexually transmitted diseases. Okay, factors to consider when selecting adolescent contraception. So while complete protection from pregnancy and STDs is obviously, it's only achievable through abstinence, approximately 1/3 of adolescents between the ages of 15 and 19 are sexually active. So nurses should feel comfortable with managing health concerns related to sexuality. And because teens may not ask or seek contraceptive advice until it's too late, the American Academy of Pediatrics actually recommends assessing for sexual activity at every visit. So when you're providing contraceptive suggestions and advice, you should take into consideration the things that are listed on this slide. We'll just hit on a few of them here. Their cognitive development. So whether they are concrete or abstract thinkers, the frequency of intercourse, the client's sexual maturity rating, which is basically, where they are on that Tanner scale I was talking about earlier. Their physical and mental health. If they have communication with their parents about this. And that's going to affect if they need to have something that's going to last longer if they're not telling their parents. So they may need something that lasts for about a month versus the pill, which the parents could find out about readily. They may, that's something they have to take every day. You also want to encourage that there is nothing wrong with abstinence. This is super important. They may feel pressure from their peers, from the media. There's a lot of pressure out there. So to hear that it is okay to remain abstinent is something that's really important. And you should voice that to them. So the meningococcal vaccine is very common in this age group. The CDC recommends that it is given between the ages of 11 and 12. And there are actually catch-ups that can be given if it is given past that age group. If it is an at-risk population based on living conditions, the vaccine may actually be administered as early as 7 to 10 years old. So this vaccine is administered intramuscularly, usually in the deltoid, and it acts by inducing the production of antibodies to protect against the invasive meningitis. The main side effects for this vaccine that you're going to want to educate the parents on or the patients on include pain at injection site, diarrhea, irritability, and Guillain-Barré syndrome.